All right, for the patient presentation, we have a Mrs. Scott who is 62 years old, chief complaint of stomach pain. She says it began 6 months ago, mid-epigastric pain, describes it as constant with dull and crampiness. She says eating aggravates it, but there's nothing that really relieves it besides vomiting. It's the same throughout the entire day except for when she eats. She describes the pain as a scale of 3 out of 10 when she's just going throughout her day, and a 7 out of 10 after she eats. And again, vomiting is what's relieving it. She has tried to change the food that she eats and the amount that she eats to see if there's any allergens that are causing these problems. She's vomiting after every meal, but she can keep down fluids. However, she has lost about 20 pounds in the past 6 months. Her past medical history is pertinent for hypertension, prediabetes, high cholesterol, artery disease. She is allergic to codeine. She has had a heart stent. She also does not have an appendix. It was taken out at 17. She was a tobacco smoker. However, she has been tobacco-free for 10 years. She drinks 1 glass of alcohol 3 to 4 times a week. She lives with a partner and dogs. Family history is pertinent for her mother, who was a smoker, died of an MI at 68 years old, and she also had COPD. Her dad died of colon cancer at 78 years old. Her medications include losartan, hydrochlorothiazide, metformin, aspirin, multivitamins, Crestor, Colace, and X-Lax. Pertinent exam findings. She did have elevated BP at 142/94. Her temp was 99.1. Her heart rate was 92. Her respiratory rate was 18. She was 99% on room air. For oxygen, physical exam findings include bilateral carotid bruits, normal lung sounds to auscultation. Her abdomen was protuberant with active bowel sounds. It was soft, mild generalized tenderness, but she did have no guarding, no rebounding, no hepatosplenomegaly, no Murphy's sign, and no CVA tenderness. Her liver was 7 centimeters in the right midclavicular line, smooth edge 1 centimeter below the right costal margin. As far as assessment and plan would go, I would feel like we would need some more information before we really create a solid plan. So I would recommend a CBC with differential to make sure she has no active infections and just get a good look at what's going on. We would want to do a CMP because she's been vomiting, so we want to make sure that her electrolytes are normal and within normal range. We would want to see a T-scan of her abdomen to rule out anything within the bowel. So we want to make sure there's not an obstruction or ischemia, because those are things that are very emergent and we would need to resolve. As far as for her pain, we would want to give her some pain medication. Nothing with codeine since she is allergic, just to help alleviate that pain. We would also want to start her on fluids because she is probably dehydrated since she has been vomiting after every meal. And work through that. Maybe even give her an antiemetic to see if that alleviates some of the vomiting she's having and get some easy nutrition in. But we are worried about mesenteric ischemia, pancreatitis, some sort of obstruction, gastroparesis, things of that nature.